Hello, I'm Erin McKeon. I'm here on behalf of Crohn's and colitis patients advocating for patient access to proper health care.
Does it concern your advocacy group that the ACA actually might be reduced in the amount of health care?
They're where to start, right? And we've really made inroads into cutting down the number of Americans without health insurance. Without immediate action, a lot of that is going to change. Not only are 10 million people going to lose access through Medicaid, but they aren't going to be able to go over and buy through the markets because they won't be able to afford them. Once these subsidies are allowed to elapse at the end of the year, we expect people's premiums to increase by up to 75%. And it's going to leave people with no options except to use the emergency room as their doctor, which not only is bad for healthcare for the patient itself, because it doesn't do anything to help with long-term health. It only solves immediate crises, but is also bad for hospitals, which are going to have to foot the bill for all of these people who are coming in for uncompensated care, which then is going to put hospitals in a dire situation, and they're going to have to increase prices for everybody across the board.
Can you just say one more time how many Americans might potentially lose their health care?
17 million.
Oh, 17 million. Okay, 17. I'm sorry, my brain froze.
10 million of them because $1 trillion was cut out of Medicaid over the next 10 years, the largest cut to Medicaid ever. And the rest through administrative hurdles and lack of support for the ACA marketplace plans.
So what would you like to see happen? What sort of amendment or policy change that you would like to see, that might help protect people?
That's hard to say. And they could also decide to walk back some of the cuts to Medicaid. There is this thought that people are gaming the system through Medicaid. Nobody gets Medicaid. It's not a benefit that puts money in anybody's pockets. What it does is cover health care. So if you have it, you can see a doctor. That's all it does. And by removing coverage, people aren't going to be able to do that.